Hi, this is Jay. This is a grossing tutorial video on how to cut in or gross in a partial radical vulvectomy for cancer, for squamous cell cancer. So what we like to do with these specimens, we like to pin them out on a portion of paraffin, and this helps the specimen look better underneath the scope for the pathologist, as opposed to just throwing it into a bucket and everything kind of shrinking up. So what we'd like to do is we'd like to try to pin these out overnight before we gross these in. Now let's go over the anatomy of this real quick. So this is a right anterior partial vulvectomy. So let's go over some normal anatomy first. Here's just a photocopy of a complete normal vulva. And just for anatomy purposes, we've got the clitoris here, the clitoral hood, we've got the labia minora. This is the left side, this is the right side. We've got the urethra, we've got the vaginal vault. So in this case, we've got the clitoris here, the clitoral hood here, we've got the labia minora here, and it was nice that the surgeon actually tagged or oriented the specimen for us, and she put a short tag, or he or she put a short tag down here where the urethral opening is right here. So once again, we've got, this is normal anatomy, this is abnormal anatomy due to tumor, and we'll go over the tumor here in a second. But so we're basically looking at, if we did a comparison of this to this picture here, we basically have this right here. And obviously the tumor here has kind of effaced or kind of made the normal anatomy look strange. But this is basically what we have here in comparison to this right here. So once again, we'll go over the anatomy one more time. We've got the clitoris here, the clitoral hood here. We've got the right labia minora here. We've got the urethra here. Once again, thanks to the surgeon. The surgeon made the suture appear at top 12 o'clock. And the short suture here for urethra. Now, looking at the pathology going on here, this right here is abnormal. This is actually a mass right here. And then all this superficial mucosa contiguous with both the mass here and contiguous with the labia minora and contiguous with the clitoris here, this is all ulcerative mucosa, all this white stuff right here. So that's concerning because it does touch the peripheral soft tissue cutaneous margins. But I think this white stuff here is just HGSIL, and right here, or this is high grade, precancerous stuff, and this is actually cancer here. So what I'm going to do next, I'm going to use some inks, and I'm going to ink the peripheral soft tissue cutaneous margins 4 different colors. I'm going to do the deep aspect another color, and then I'm going to go ahead and do the opening of the urethra another color. This is we basically process these like we would do just a skin excision for squamous cell cancer. One thing that's kind of different here is we have landmarks or anatomical landmarks that are present for this partial vulvectomy. So we'll go ahead and ink those areas I talked about, and we'll come back and we'll go over more of it. So I removed the vulvectomy from the paraffin block, took all the pins out, and then I went ahead and inked the peripheral soft tissue cutaneous margins differentially based off clock face. So this is 12 o'clock here. This is the urethra or urethral opening here, designated per surgeon. But what I basically go with is here's 12 o'clock. I kind of make a straight line going down here. So this is going to be about 6 o'clock here. And then you have 9 o'clock here, 3 o'clock here. So we're talking about a clock type of orientation. So here's the clock, here's 12, here's 6, here's 3, here's 9. So we're talking about 12 to 6, 9 to 3 o'clock. And what we're basically going to do is ink the periphery, cutaneous and soft tissue margins differentially from 12 to 3, 3 to 6, 6 to 9, 9 to 12. And then we'll flip it over and ink the deep aspect of it another color. And then last but not least, we'll do the urethra here another color, which I haven't done yet, which I'll show you here in a second. So if you flip this over, you can see that I inked the peripheral soft tissue cutaneous margins 12 to 3 o'clock blue, from 3 to 6 o'clock green, from 6 to 9 o'clock red, from 9 to 12 o'clock orange, did the deep aspect black, and then last but not least, I'm going to take some of this really bright yellow, and I'm going to put some of it right there, and a little bit on the deep aspect of it, overlying the green ink here. And I'm going to try to not smear this everywhere, but I'm going to try to do that. And then what we do is we put vinegar on it, and that kind of seals it, or not really seals it, but kind of keeps the ink, makes it stick to the tissue. It's called a mordant, the vinegar. And now what we're going to do is, basically, once I mentioned, like I mentioned earlier, with these vulvectomies, you basically treat it like a skin excision. And we're going to do a bunch of perpendicular sections. And the reason we're doing that is we want to show the relationship of this tumor here and this pre-tumor cancerous stuff here to the margins. And so we're going to do perpendicular sections here. And what I like to do is I like to pre-cut everything before I take everything off, so I can kind of keep my order correct and stay organized. So what I'm going to do is, like I said, I'm going to take some sections here, and I'll pre-cut everything before I take it all off. So I'll come back in a second, show you all the pre-cuts, and then we'll talk about submitting this lesion here, actually. Okay, so here is an annotated picture of the sections I'm going to be taking. And like I said, I pre-cut everything, and now I'm going to do is take all the sections out. So from this annotation here, I'm taking out the entire clitoral hood and clitoris in these 3 blocks, or these 3 sections here. I'm taking out this. So as I was cutting this specimen, making the pre-cuts, I found an additional lesion right here at the edge over here near the clitoral hood on the left side, and it was actually abutting the soft tissue cutaneous margin here. So I'm going to take this area here as well, and then here's the urethra here. Here's just some additional sections, because when I first started doing this case, I talked about this polypoid lesion, but there's also this white area all along here, which I think is precancerous stuff, and we want to see if there's any actual cancer, or maybe it's still precancerous, and we want to see a relationship of that area to this margin here, which is the closest margin to this area. This is just a random section of the labia minora. Actually, these 3 sections are, and then I'm going to submit the entire mass here on 11 and 12. So that's kind of the annotated version, and like I said, I've already done all the pre-cuts, so now I'm just going to take all these sections out, and the very last thing I'll do is I'll block this out and submit that in the relationship of that to the deep aspect.